My best advice is fly knowing that there are certain things that you can do to protect yourself and to decrease your risk when you're flying. The most common question that a patient or any patient will ask me is, where can I go? How far can I go? And what should I do? Where you can go is essentially worldwide. In longer flights, in general, patients should know that certain precautions such as stretching the legs, keeping your legs from essentially being in the same position for 8-10 hours is never a good idea, and that applies, of course, to car travel as well, because something called stasis, where the blood essentially pools, is never a good thing, because pregnant women are more predisposed to blood clots than, say, a non-pregnant female. If you look at a transcontinental flight in the United States, the approximate amount of ionizing radiation will be about 6 millirem. In contrast, the maximum exposure recommended by some authorities for an adult is approximately 100 millirem. So it's far below the threshold that they have deemed as a maximum exposure. So of course the next question is, how much radiation can my baby incur, and what are the risks for radiation? And again, the authorities have looked at that, and in the past they've shown that 500 millirem or below has not been tied to any risks to the fetus, and therefore, again, 6 millirem compared to 500 millirem is far below the threshold. There is no reason to avoid air travel. There is plenty of reason to exercise precautions, such as, again, stretching your legs, staying well hydrated, and to know that there are certain things you can do to prevent any problems for flying. There is, however, a corollary to that, and that is if a pregnant woman has certain complications, for example, preeclampsia, a predisposition to preterm labor, or if she's had preterm labor during this pregnancy, or other things like chronic diseases like sickle cell disease. These are conditions that may prompt a patient not to travel because of the much higher risks to the pregnancy.